Well, some expectant moms here on the First Coast are not allowed to have the support system they'd hoped to have inside the delivery room when they're giving birth. Because of COVID-19, hospitals are restricting women to having only one companion with them when they deliver. And as On Your Side's Eliza Powell shows us, that's leaving someone important to a lot of women out of the picture.
Safety can't trump birthing rights for women.
In March, Jacksonville labor and delivery wards restricted the number of support people in the delivery room for laboring moms because of COVID-19.
They were forced to choose between their partner or father of the baby and their doula.
A doula is someone a mother hires who is trained to help support expecting mothers in their right to decide what happens to them and their baby during delivery, and most importantly,
they are bettering birth outcomes
by using techniques to help moms deliver naturally when possible and preventing unplanned C-sections.
It's just unrealistic to continue to keep the doulas out.
Kristen Murillo, a local doula, says she's seen the absence of doulas during labor have dramatic mental and physical effects on moms.
Much higher rates of cesarean birth, traumatic birth experiences.
Ali Bermejo says the birth of her first daughter in April was completely different than how she'd imagined because Murillo wasn't in the room.
It was rough emotionally to not have the support that you planned on having.
Feeling like moms' birthing rights are being trumped during COVID, doulas across the state have signed a petition urging Governor Ron DeSantis to allow them back into the delivery room.
We have many, many women who are backed into a corner.
So far in Jacksonville, only St. Vincent's Hospital has allowed doulas back in. Murillo says most hospitals tell her they aren't allowing doulas as extra support until at least 2021. In Jacksonville, Eliza Powell, First Coast News, On Your Side.